Introduction to Knee Replacement Recovery.
Recovering from knee replacement surgery involves patience, movement, and consistent care. The right exercises can help restore freedom of movement, reduce stiffness, and rebuild strength around your new joint. Start gently, listen to your body, and follow healthcare guidance for a smoother journey back to daily life.
Ankle pumps and circles.
Simple ankle movements keep blood circulating and reduce swelling. While lying on your back, gently point and flex your toes up and down, then make slow circles with your feet. Practice several repetitions throughout the day, as these exercises help prevent blood clots and promote healing after knee surgery.
Heel slides for flexibility.
Heel slides help improve knee flexibility and range of motion. Lie flat with your legs outstretched. Slowly bend your operated knee, sliding your heel toward your body as far as comfort allows. Hold briefly, then straighten your leg again. Repeat this movement to gently loosen the knee and encourage safe bending.
Quadriceps sets for strength.
Strengthening your thigh muscles supports your new knee joint. With your legs straight and relaxed, tighten your front thigh muscle by pressing the back of your knee into the bed or floor. Hold for a few seconds, then release. Repeat several times to help regain leg control and stability during recovery.
Seated knee extensions.
Seated knee extensions build strength without putting too much strain on your new knee. Sit in a sturdy chair with your feet flat. Slowly straighten your surgical leg until it's fully extended. Then hold for a few moments before lowering it back down. Repeat as advised, helping restore strength and improve mobility.
When to progress and seek guidance.
Always consult your doctor or physical therapist before starting or advancing exercises. Progress at your own pace, adding new challenges as comfort improves. If you experience severe pain, swelling, or difficulty, seek professional advice promptly to ensure a safe and effective recovery.